South Florida State College is your place to build a solid allied health career. We offer many programs of varying length, all of which exist to meet the healthcare demands of our community. You can choose from short-term programs of a few weeks' duration, one-year occupational certificate programs, or associate in science degree programs that can take up to 3 years to complete. All allied health programs have limited enrollment, which means acceptance is competitive and class size is limited. Numbers accepted for each program are determined according to clinical space available and instructor-to-student ratios in clinic. Since admission is competitive, it is necessary to perform well in prerequisite courses and on pre-admission tests. In addition to applying to the college, all allied health programs require a second application. Let's look at the process to apply. To obtain a full understanding of South Florida State College, visit our website at www.southflorida.edu. If you are not already a registered student of the college, complete an application found on www.flvc.org. Send high school and previous college transcripts to the registrar. Make sure you have a current FAFSA on file in our financial aid office. After learning about your financial aid options, make an appointment to speak with an academic advisor. The college has a limited enrollment program advising specialist who can answer your questions about prerequisites and other admissions criteria. If program admittance requires taking the TABE exam, an advisor can make arrangements for testing. Complete developmental English or math courses if indicated. Otherwise, you can register for prerequisite courses specific to your desired program. 3 of our programs require observation hours to give potential students a full understanding of the profession to which they are applying. Dental assisting 16 hours, dental hygiene 40, and radiography 8 hours. After all prerequisite courses have been successfully completed, you can apply to the desired program. Nursing applicants are required to take the NLN exam as part of admissions requirements. Scores are used in determining rank on the admissions list, so prepare well. An advisor will assist you in obtaining a study guide, and staff in the Tutoring and Learning Center can assist with practice exams. There is a 10-week window for submitting program applications. Advisors at any campus will begin accepting applications the second week of January through the second Friday of April. To find the program application flow chart for a specific program, click on the Allied Health tab on the menu to the left of the page. All programs will be displayed, and you can click on the tab for your desired program. Here is the nursing program's web page listing all choices in that department. Click on your desired program's application process. Click on Open First Instructions box and print out the page to help you navigate through the rest of the flow chart. Clicking on each box will either open a form or provide more information. All letters of acceptance are conditional. You must present a clean background check, be current with immunizations and vaccines, and pass a 10-panel drug screen in order to participate in clinical rotations at our affiliated health facilities. If you are not allowed in the clinical facilities, you will not be able to complete course objectives. The rest of this presentation will present specific information about each program. South Florida State College's dental education programs are accredited by the American Dental Association. Dental education offers 2 programs, dental assisting and dental hygiene. Both have limited enrollment of 12 students for each program. The dental assisting program can be completed in 1 year and requires minimum TABE scores of 11 in reading and language and 10 in math prior to receiving an occupational certificate. Dental hygiene requires completion of 6 prerequisite courses with a combined grade point average of 2.75 prior to application. Upon completion of program, students are awarded Associate in Science degree. Graduates of the Dental Assisting Program will also earn an Orthodontic Assistant Certificate as well as Danby certification, providing all three parts of the exam are passed. Graduates from the dental program find employment in private dental practices and community dental facilities. Dental assistants work closely with the dentist, performing duties as assigned. Dental hygienists work more independently throughout the day, providing preventive services for the dentist's patients. Dental assisting students are assigned rotations at affiliated dental and specialty dental practices in Highlands and Polk counties for half and full day assignments. There they receive hands-on training from dentists and preceptor dental assistants. Dental hygiene students practice their skills by treating family, friends, and residents from the community in the dental clinic on campus. Students also participate in community dental health events at various locations throughout the county. Earning a grade of C or better is a must to remain in the program. Dental education classes meet from 8 to 5, Monday through Friday. Outside employment while in either program is not recommended, as you will need ample time to study for class and participate in extramural activities. Personal characteristics for success in the dental field include good communication skills, good eye-hand coordination, able to perform small precise movements with hands, must like helping people and be open to cultural differences, must be reliable and a serious team player. Working with patients requires good critical thinking skills and quick problem solving. South Florida State College offers the full spectrum of emergency medical services, with each level being a prerequisite to the next. Success in the Emergency Medical Responder course is necessary before applying to the EMT program. TABE scores of 10 are required for admission to EMT and paramedic programs. Emergency medical responders assist EMTs, and the EMTs assist the paramedic in charge when called to an emergency. Responsibilities of the paramedic are more complex and critical to patient survival. The EMR course offers rudimentary instruction on assisting at the scene of an emergency. Skills learned in the EMR course are built upon in the EMT program. EMT applicants must be at least 18 years old with a high school diploma, valid Florida driver's license, and current CPR card. EMT students are in lecture and lab 3 nights a week from 6 to 10 p.m. for 1 term. Program requirements include 10 hours of observation in an emergency room and 50 hours of ambulance ride time, both under close supervision of a program preceptor. A minimum grade of 75% for all classroom and 80% for lab, clinical, and field externship evaluations must be maintained for graduation. Paramedic is the longest of the EMS programs and requires successive completion of EMR and EMT prior to application. Paramedic students attend 14 hours of lecture per week, scheduled in a way to accommodate EMT work schedules. Paramedic students have mandatory hospital clinical experience, which includes rotations in emergency, obstetrics, intensive care, operating room, and psychiatric units. Ambulance field externship is more extensive than for the EMT program, requiring more hours and more complex skill competencies. Students work one-on-one with clinical preceptors while on hospital rotation and during field experiences. Most of the field training is hands-on and will test ability to problem solve and think critically. Selection for the program is based on date that completed application is received. Students already working in fire and EMS fields are given preference in the paramedic program. Characteristics for success in the program include leadership ability, being a positive and caring person, good critical thinking skills, and ability to work as a team player. South Florida State College nursing education programs enjoy a stellar reputation within our medical community. At South Florida State College, there are many levels of nursing from which to choose. Program length varies from 165 hours for nursing assistant to the 2-year associate degree RN program. Enrollment is limited at each level, so strong performance in prerequisite courses and on entrance exams is critical for acceptance. Each level of program articulates into the next higher one. Nursing assistant duties are basic and reinforced and built upon in the LPN program. RNs have the most job responsibility and perform the more critical functions of nursing. RNs also serve as the coordinator for a patient's total care. The college offers CNA courses twice a year, once in fall and once in spring at either Highlands or Hardy campuses. Class size is limited to 15 with students selected according to date that completed application is received. Classroom and lab instruction takes place in our modern education facility in the Health and Science Education Building, equipped with an abundance of teaching models. The next level of nursing, the LPN program, takes about 1 year to complete. You must first be successful in the 3 prerequisite courses prior to making application. Acceptance is limited to 24 students accepted in the fall. LPN students must maintain 75% or above in all coursework to remain in the program. Students wishing acceptance into the RN program must successfully complete these 7 prerequisite courses prior to making application. The RN program is seeking initial accreditation from the National League for Nursing Accrediting Commission and has achieved candidacy status. Earning a minimum grade of 80% is required in all coursework in order to remain in the RN program. Transition program is designed for currently licensed LPNs wishing to advance in their training to RN. The program is 1 year in length with classes scheduled to allow for continued employment. Prerequisites are required for the transition program, just as in the RN program, with the addition of Principles of Nutrition and Diet Therapy course. Class size in the transition program is limited to 24. Transition program builds on previously acquired knowledge and skills, which allows for upward mobility in nursing. Students in all nursing programs will have assigned exercises using high-fidelity simulators in South Florida State College Nursing Simulation Lab. Characteristics for success in the nursing program are being a positive and caring person, striving for clinical excellence in all areas of patient care, having good critical thinking and problem-solving skills, ability to organize and set priorities, and being a supportive team member. The radiography program awards an associate in science degree upon completion of all coursework. As in other associate degree programs in allied health, radiography students must complete courses in general education as well as program-specific courses. There are only 3 prerequisites for radiography that must be completed with a C or better. Placement in the limited enrollment program is based on cumulative grade point average of the 3 courses, so achieving high grades is important. Graduates of the radiography program find employment in hospitals and private physician offices with imaging departments. Radiography technologists serve as critical members of a diagnostic team, produce X-ray images, administer drugs for X-ray scans, and maintain diagnostic equipment. Radiography instruction is divided between classroom and lab located in the Health and Sciences Education Building and clinical rotations at affiliated health facilities. South Florida State College Radiography Department has state-of-the-art digital equipment similar to what students use in clinical rotation at affiliated hospitals. The radiography program has affiliation agreements with 5 hospitals that host students on rotations: Florida Hospital in Sebring, Lake Placid in Wauchula, DeSoto Regional Medical Center, and Highlands Regional Medical Center. Students practice patient positioning on phantoms and each other before producing X-ray images for patients at the clinical sites. The radiography program is nationally accredited by the Joint Review Committee in Education Radiologic Technology. This assures the curriculum meets national standards of excellence. Class size is limited to 12 students accepted each fall. Small class size is necessary for placement at affiliated clinical facilities. Attesting to the excellent instruction, the radiography program has a high student completion rate, and a 5-year average pass rate of 97% on the ARRT credentialing exam. Phlebotomy is a 160-hour program with irregular offering. Notice of course registration is placed on the college webpage. Coursework consists of classroom and lab on campus and clinical rotation at blood drawing facilities. Graduates collect blood and urine specimens by physician prescription and carry samples to the lab. Whatever program meets your interest and fits your personality, choosing South Florida State College for your allied health educational experience is a wise investment in your future. Graduates from our program are confident in their skills and well prepared for employment. Whether you are just starting out or returning for a higher degree, our programs are focused on student success.